Hey guys, I just wanted to say thank you for all of your feedback. A couple months ago I posted a video just explaining about how I was modifying some of my adjusting to finish at a neutral position, and I've gotten a great amount of feedback, and lots of people have watched that video, and I really appreciate all that feedback. And I just wanted to clarify just a few things about that adjusting. I mentioned that I do a couple motion or a Carrick's technique. That's a technique that I've always used, so I've modified that technique to adjust and finish at a neutral position. But I also want to say that it's also entirely possible to use other techniques, to use diversified, to use Gonstead, and achieve the same thing. So it isn't technique specific, it's just a matter of how you set it up so that you can just finish at the neutral position. It's not that difficult. I also put up a video showing what it looked like, and I think that caused a little bit of confusion, so I wanted to clear up that confusion as well, and just say it doesn't really look that different in the setup, but what's actually happening is instead of holding a joint and moving it to the end range and then following through into the paraphysiologic space, in that setup what you're doing is you're finding, sorry, let me go back a second. Before you adjust and you're palpating, instead of palpating and starting in neutral and moving the joint away from neutral to find where you feel the resistance, what we're going to do is take the joint in various positions away from neutral and find where we feel resistance coming back to neutral. So that's how we establish the vector. There's also lots of ways that I've modified my diagnostic tools to see where the person has a difficulty coming back to neutral. So we'll see this in all kinds of things. When we do like fields of gaze and things, instead of looking and finding the difficulty coming out to the side, what you want to do in this approach would be to find where there's difficulty coming back to neutral from whatever vector it is. So if you see that there's a vector where there's a difficulty coming back to neutral, then maybe there's some head component of that as well. Okay, and then you'll find that your eye exam is going to match up with the joint function and the inability of that joint to come back to a neutral position. So sometimes you'll see something where there's a certain position of the eye coming back to neutral where there's difficulty in that, and that would be parallel to a head or neck function. Okay, so again, the first concept, and I realized I didn't say it clearly before, was that we're having difficulty coming back to neutral, and so you have to establish which joint isn't getting back to neutral before you can adjust. So say for instance, if you laterally flex to the left and you try to bring it back to neutral and you feel that there's more resistance, then that would be the vector that you'd be adjusting in. I think we all have to be very aware of the complexity of joint motions and to be able to align and create a setup where you can find the most resistance exactly to neutral is really what the key is in the setup. So we're not just doing like a lateral flexion, or we're not just doing a rotation. What we're doing is by coming back to neutral, instead of coming and rotating around the axis of rotation to increase right rotation and right lateral flexion, what we're doing is aligning all the vectors away from neutral, where you can go straight into the rotational center of the joint. So your adjustment is literally straight into the center of the joint. So it's going to be a little bit like you do a lateral flexion move, but it could be from any sort of vector. Okay, wherever that vector of resistance is coming back to neutral, that's where you're going to adjust, and you're coming straight into that sort of central point of rotation of the joint. So, and it's very, very, very small and precise. So in the setup, what you're doing is bringing the joint off to the side, and when you adjust, you just boom, just bring it straight back to neutral, and you try to finish at neutral. So again, it seems strange. It's hard to show you because it looks kind of like any other adjustment. When you feel it, it's pretty obvious what's happening. But it's very, very, very comfortable because, again, you're not locking any joints out. There is resistance in the joint, so this is another sort of misconception people had, was that you're adjusting into no tension. There's definitely tension, because what you're doing is you're trying to set up again and find where that resistance is to come back to neutral. And once you can find that vector, then all you have to do is just hit it there, and then the whole thing lets go. So it's, again, we're not adjusting with no resistance. We're absolutely adjusting with resistance, but it's just that setup is off neutral, and then the finish is at neutral. So I hope that answers some questions. I'm going to try to figure out some other ways of sharing this, but I've shared this with a few of the chiropractors, and they're actually getting some really great results with this as well, like I am. I'm just finding we're getting a lot more stability in the joint straight away. It's super comfortable for people, and so it's quite fun. I'm really enjoying this. All my patients really love this. If there's any way I can help you, or if you have any more questions, please post them. I think it's quite an exciting thing, and it makes a lot of sense to me from a neurological perspective as well. So again, just give some feedback, let me know, and if there's any other ways I can contribute to this concept, just give a shout. Okay, thanks for watching.